Welcome back with another video lecture. In this video lecture, we will study and focus on white blood cells or leukocytes. White blood cells that are present on bloods are of 5 categories: lymphocyte, monocyte, eosinophil, basophil, and neutrophil. All these WBCs are body defense cells or immune cells because they defense body from foreign agents. So all these WBCs are termed as leukocytes. They are irregular and nucleated cells and are larger than RBCs and platelets. They are divided into 2 categories, that is agranulocytes and granulocytes. First we have agranulocytes or non-granulocytes. Remember that agranulocyte does not have specific granules just like granulocytes. They have granules, but they are non-specific granules. Actually, those WBCs which have specific granules are called granulocytes, and those WBCs which do not have specific granules are called agranulocytes or non-granulocytes. Agranulocytes are further divided into 2, the lymphocyte and monocyte, while granulocytes are further divided into 3, eosinophil, basophil, and neutrophil. It must remember that granulocytes will have suffix "phil" just like eosinophil, basophil, and neutrophil. Granulocytes have eosinophil, which have bilobed nucleus and have specific granules stained by acidic dyes. Eosinophils are the cells that love red colors, so their granules stained red color. Basophil also have granulocyte having bilobed nucleus, and neutrophil have nucleus which are multi-lobed nucleus, that is 2 to 6 lobes. It has 2 types of granules. Some take acidic dyes and some will take basic dyes. They are of 2 types of granules which appear in their cytoplasm. So let's see agranulocytes or non-granulocytes and how will we differentiate lymphocyte from monocytes. Lymphocyte have very large nucleus and very little cytoplasm. It is best way to recognize the lymphocyte based on their nucleus, that is 1/3 nucleus, while monocyte have kidney-shaped nucleus and are smaller than lymphocyte, while granulocytes are WBCs that have granular appearance in their cytoplasm, as you can see in the diagram. Also, their nucleus are divided into multi-lobes. Now let's discuss each WBCs in detail. First we have neutrophil. Neutrophil are a type of leukocyte that acts as your immune system first line of defense. Neutrophils are the most abundant cells among all WBCs, and they make up 40 to 70% of all WBCs. Structurally, neutrophil are 10 to 12 micrometer in diameter and having 2 to 6 nuclear lobes, also having fine pale and species granules. Neutrophil have special role in immunity because when microbes such as virus or bacterial pathogen enter to the body, neutrophils are the one of the first immune cells to respond. They reach to the site of infection where they destroy the antigen by ingesting them. After engulfing the pathogen, it releases several enzymes just like lysozyme, strong oxidant, and defensins that kill the pathogen. It also boosts to response other immune cells. The lifespan of neutrophils from 6 to 9 hours in bloodstream and are high in tissues. that is 2 to 5 days. Neutrophilia, when the neutrophil count increased than normal or greater than 75%, we called it neutrophilia, and it is associated with acute infection or inflammation, vaccine, after hemorrhage, metabolic disorder, drug poisoning or chemical poisoning. So in all these situations, neutrophil became very active and their number increased in blood. Neutropenia means decreased neutrophil count than normal. It is most commonly seen in bone marrow disorder, typhoid fever, vitamins deficiency, and tuberculosis. Then we have eosinophil. Eosinophil have bilobed nucleus and they take acidic dye eosine and appear is red. Eosinophil was first described for its characteristic cytoplasmic granules, approximately having 200 granules in their cytoplasm. Eosinophil are few cells and can be found at the site of allergic inflammation. They are 8 micron in diameter. Eosinophil have specific role in parasitic infection and promote tissue inflammation by releasing toxic chemical. Their lifespan is 7 to 12 days. Then we have eosinophilia, a condition in which eosinophil count increased than normal, and it is most commonly seen in asthma, allergic condition, blood parasitism like malaria, intestinal parasitism, bacterial infection caused by Streptococcus species, fever, skin rashes, and scarlet fever. In all these conditions, eosinophil count increased than normal. They are active in all these conditions. Eosinopenia are a condition in which eosinophil count decreased than normal. They are seen in bacterial infection and prolonged stress. Then we have basophil. Basophil are a type of white blood cell and are least common type of granulocyte. They are about 0.5 to 1% of WBCs, which are closely associated with allergic reactions. Basophils stain blue with alkaline methylene. Structurally, basophil are 8 to 10 micrometer in diameter, also having bilobed or irregular nucleus. It contains round blue-black granules may obscure the nucleus. They can exit capillaries to enter tissue fluid and can mature to mast cell. The cytoplasmic granules of basophil are packed with heparin, which is an anticoagulant agent, and histamine, which is an inflammatory agent. These granules releases their content due to allergen. They are closely associated with hypersensitivity or allergic reaction. Their lifespan is variable, that is 4 to 8 hours in circulation or bloodstream and 4 to 5 days in tissues. Basophilia. Basophilia is a condition in which basophil count increased than normal or 2%. Remember that basophil is least abundant cell in WBCs. Sometime out of 100 white blood cells, we did not found any basophil. Basophilia is most commonly seen in type 1 hypersensitivity reaction, smallpox, chickenpox, polycythemia, that is bone marrow hyperplasia in which blood volume increases. Basophilia, a condition in which basophil count decrease than normal. It is associated with urticaria, stress, radiation, and chemotherapy. Then we have non-granulocyte lymphocyte. Lymphocyte include natural killer cell, T cell, and B cell. They are the main type of cell found in lymphoid tissues, which prompted the name lymphocyte. It make up between 18% to 42% of circulating white blood cells. Remember that lymphocyte are smaller than monocyte. It circulate in bloodstream and also have high numbers in lymphatic tissues. Lymphocyte originate from stem cell in lymphoid tissues. They give protection against viral infection and cancerous cells. Their lifespan is few hours in circulation and larger in tissue, that is 100 to 300 days. Lymphocytosis mean increased lymphocyte number than 40%. It is seen most commonly in viral infection and chronic infection, which are associated with hepatitis, mumps, malnutrition and rickets, etc. Lymphocytopenia mean decreased lymphocyte count and are associated with HIV or AIDS, malnutrition, radiation therapy, steroids administration, Hodgkin's disease, which is cancer of lymphatic system. In all these conditions, lymphocyte count decreases than normal. Monocyte are largest among all WBCs and are about 14 to 18 micrometer in size. They have bean-shaped or kidney-shaped nucleus. Monocytes are motile and phagocytic cells. Some migrate to tissue and develop into macrophages, which are responsible for phagocytosis. It involved in inflammation. Their lifespan is short in circulation and are high in tissue, up to year in the form of macrophages. Monocytosis mean increase monocyte count than normal or 10%. We called it monocytosis. Monocytosis is seen in chronic infections or long-term infections like tuberculosis, syphilis, and monocytopenia mean decreased monocyte count than normal. It is seen in prolonged use of steroids, lymphoid leukemia and AIDS. Then we have two terms, that is WBCs count or TLC or differential count or DLC. Total leukocyte count mean in 1 ml of blood how many number of white blood cells are present. It is about 4,000 to 11,000 in all healthy adults. When we talked about DLC or differential leukocyte count, it means out of 100 of white blood cells, what are the percentage of neutrophil, eosinophil, monocyte, basophil and lymphocytes, etc. And all these, the most abundant cells are the neutrophils. They are produced in bone marrow, except lymphocyte that are matured in lymphoid tissues. Thanks for watching. If you like the video, don't forget to subscribe.